Hi, my name is Felicia Brown.
And I'm Audra Hyra,
We're with Professor Burke's group,
level 4.
level 4, and our patient is on cirrhosis. We are doing a clinical teaching on a patient.
Mr. John Richards, which is a 45-year-old male.
He presents himself to the ED department with abdominal pain that has been worsening with nausea and vomiting for the past 3 days and has not been resolved. He's feeling more fatigued and has a poor appetite. He has a history of alcohol abuse for the past 25 years. He's a previous IV use of heroin. He is not married, he is unemployed, and he lives alone.
He has no health insurance and also has diagnosis of hepatitis C and also has no medical insurance.
And has had minimal follow-up care since then.
Yes.
So today I'm going to teach Mr. JR on what to look for and signs and symptoms, how to prevent, and his medications. So, Mr. JR, how are you feeling today?
I'm a little tired and fatigued. I'm not sure what's going on with me. Can you tell me a little bit more about cirrhosis?
Yes, absolutely. Are you feeling a little bit better since taking your medication?
Yes.
You know where you are today?
Yes.
Name and date of birth?
Yes.
Okay. Alert and oriented. So, cirrhosis, what is going on with you today is because of your previous drinking history for the past 25 years and having that history of hepatitis C, your liver is having a hard time reorganizing and replacing all of the liver cells in there. So what that does is it gives scar tissue around your liver. Some are big, some are small, and that impedes blood flow and making it very difficult for it to repair itself. With that being said, there's a few factors that you will need to do as a patient to help yourself, as there's only so much the medical staff can do for you to help yourself.
Okay, can you tell me some of the symptoms, like the signs and the symptoms of cirrhosis, or what I will be feeling so I know ahead of time?
Yes, so cirrhosis is the end stage of liver disease, and unfortunately, if it's not taken care of right away, it is the 8th leading cause of death, mostly amongst men. So what you would experience is what you are today, the fatigue. You would have, your skin would almost look yellow, or the whites of your eye might look very yellow. That is a buildup of the bilirubin in your system. If you notice that, I want you to contact your provider right away. Sometimes your abdomen can be very large overnight sometimes, and that is called ascites. And that is when you have a lot of fluid in the interstitial space of your abdomen. You can kind of, if you put your arms out to stretch and they flap, that is also a late sign that we want you to contact us right away. Is there anything else I can help you understand?
Also, I wanted to know about the medication that I've been taking, the lactulose. It's making me go to the bathroom a lot, and I'm having a lot of diarrhea. So am I going to take this medication?
Until the physician says otherwise, yes, you need to take this medication. This is going to help release all of the ammonia buildup that is in your system that has affected your brain, that made you very confused earlier. The unfortunate side effect of that is the diarrhea, and that's why we are encouraging you to take extra fluids in addition to the IV fluids that we have hang on up for you. That's going to help prevent with dehydration, and that will also help prevent constipation. With that being said, with your diet, we also want you to incorporate some good high calories and good carbohydrates in your system. And we will need you to also decrease your sodium intake.
Okay, what are some of the food that I have to avoid?
With sodium intake, I understand you said you were living alone at home. Sometimes that makes cooking very difficult to do for yourself. So the easy go-to are fast food restaurants. Those are not good for you. You also want to avoid any processed meats such as like your lunch meats or salami, your cold cuts. You want to avoid any soups or canned foods that are all high in sodium. Um, so those things are the ones you want to avoid, but you want good carbohydrates, good healthy vegetables, fresh vegetables would be best, um,
Okay.
and good high calorie intake. The more calories you have in there to help you.
Okay, so at home I usually take like Tylenol when I have a headache. And is there any medications that I have to avoid?
Yes, you want to avoid Tylenol. You want to avoid
Oh,
any aspirin, um, any of those NSAIDs, non-steroid anti-inflammatories. Those are not good for you. Those will hurt your liver more because your liver will not be able to process and metabolize that.
okay.
Um, you really want to kind of avoid those at all means.
Okay. Also, I want to know if I could have a list or places where I can attend AA meetings. I don't know if you guys have those available.
Yes, I have this paper here for you with a list of um, places that do have those meetings available for you. There are a few local organizations and churches around the area that do provide that for you. That would behoove you to go to these to help control any urges. Get yourself a sponsor. If in the time of need you have those urges, you can contact them to help you. Here's also a list of medications and foods to avoid to help you with your dietary restrictions
Mm-hmm.
and what medications to avoid.
Okay, so I think I have pretty much everything here that I need, and I just have to follow up. But I'm also don't have insurance. Who can I contact to maybe get insurance so I can have a follow up with my primary?
We have already reached out to a social worker in the hospital to contact you before you leave
Okay.
to help get you situated with a possible primary care physician in the area. And we can work with your income as well to get you situated.
Okay. Well, thank you for all the information. It was very helpful, and the pamphlets were very helpful.
That concludes our teaching.